Thanks for joining us tonight. Doctors are trained to help anyone who comes in, but they say sometimes patients won't accept them because of the color of their skin. Madeline O'Neill tells us how Madison's 3 major health systems are all putting strong anti-discriminatory policies in place.
I can honestly say it has gotten worse, which is the shocking part.
Also shocking is Dr. Debbie Jones' story.
We are still dealing with racism, even in a place like a hospital.
Like when a patient admitted through SSM's emergency department a few years ago nearly refused her care.
He had this stipulation that there would be a white nurse in that room at all times when I was in there. I still remember the pain of that.
It's not just her story.
There is not a single healthcare provider that I know of personally of color who has not had this happen to them.
It's probably the worst kept secret internally within healthcare.
SSM Health Regional President Damon Boatwright says these types of situations often go unreported.
Many of our frontline workers are risking their own lives and sharing their time to take care of other patients. We feel this is the best time that we need to stand up for them.
SSM is standing with UW Health and Unity Point Health Meritor as the health systems adopt anti-discrimination policies, which won't allow patient requests for alternate caregivers based on their own bias.
I am moved beyond words.
Dr. Jones has another story, this time from her previous practice.
He wanted me to know that he had never had a woman physician, and he had never had a physician of color.
She helped him and sent him on his way, not expecting him to ever return.
And when I left that practice, he was the first patient sitting out in a waiting room with tears in his eyes to say goodbye. He and I had grown so close over those 5 years.
It's that story Jones keeps close to her heart.
That gives me hope that we will live to see a better day.
In Madison, Madeline O'Neill, News 3 Now.
SSM Health says it'll even organize a transfer for a patient refusing care because of bias as long as they're stable. They're also planning to start tracking such situations.